We were trying to standardise our management of shoulder patients across the patch. So we've got 9 community sites where patients can be seen post-operatively, and we were aware that sometimes physios weren't seeing very many post-operative patients each year, and so therefore their knowledge of which stage each post-operative patient was at was not perhaps up to date. So the videos were really designed to try and standardise care, and also then we realised that actually we could direct patients to them, so that would help to support their care and their management at whatever stage of recovery they were currently at. Obviously quite useful for carers as well, so if the patient is not able to self-care, quite handy for patients' carers to know how to help them dress and how to help them with washing, and how to put slings on and off, which is always a little bit of a tricky one. Even when you're used to doing it, sometimes you get the belt around the wrong way, so it's quite handy to have the belts there. And again, for our physio colleagues out in peripheral hospitals, again, how do you put a belt on and off sometimes if you've not seen one for a year? It's quite handy to be able to have that as a source of reference. So patients are given this on the day of their surgery. They're given the link, they're given a little flyer to say this is what you need to do. Subsequently, you will then go off to physio appointment, or if you feel that you would like to progress to stage 2 and stage 3 in time, then you can do that without needing to go off and have a physio appointment. And we do understand that quite a few people have found this particularly useful. It's also been useful in clinical practice, just speaking about the shoulders here particularly, as to when you see a patient as a follow-up, they've had their surgery, they've done all their stage 1 stuff, they come to you for their stage 2 things, and you go, oh, have you looked at the video? And they go, oh yeah. They go, right, it's time for you to do that now. And then you say, you know, you can come back and see us. If you come back and see us, we'll just simply be going through stage 3. Obviously, we're here to answer any questions or queries that you've got at stage 3, but if you feel that that's appropriate, then you know you're perfectly capable of going on to stage 3 by yourself and just progressing your exercises and your function. So that's been quite useful for us over the last few years, and we've found it hugely beneficial. The patients that come to us are post-operatively are much further on in their knowledge and their awareness and their general confidence of their condition, because they've got that resource to back them up. So if they go home and they can't remember what we've said to them, they've got a video there which pretty much says the same thing as what we would be saying to them in clinic. The belief was that the videos would completely eliminate the need for follow-up physiotherapy post-operatively. That's not been the case, but patients do at least have the choice if they live a long way away or it's difficult for them to get to us because of work or caring commitments, then they can actually just be assured that they can run by the video. So one of the things that we noticed that was quite useful for us was trying to, we used to have to try and write down a particular stretch that's on our videos, which is called the sleeper stretch, which is external rotation, stage 1 and 2. And it's a really complicated thing to actually have to write down. It's not included on any of the libraries that we have electronically at all. And so we would spend quite a long time trying to write it down so the patient would understand little stick men, because we didn't have any pictures of it. So being able to direct somebody to a video whereby a picture tells a thousand words was hugely beneficial. And we know that people are going to do it correctly because there's no margin for error. They watch the person's doing it right, therefore they do it right. Sometimes the person was doing a sleeper stretch with their elbow out to the side. That's not the right way to do it. So if you look on the video, it tells you you must keep your elbow tucked in. So it's reducing the margin of error for people doing exercises, because often people do come to us and you say, okay, show me your exercises, and they show you something that you're there going, well, I'm pretty sure I didn't teach you to do it like that. But you've got that backup resource so that you know that people can actually look and see somebody doing it, which reduces the margin of error, improves patient compliance and obviously patient safety, because we want to make sure they're doing the right exercise as prescribed.